And we are live, kind of, for Lubbock Compact Live for Wednesday, September the 25th. I am your host, Adam Hernandez, here with my co host, Josh Shankles, and here with Dr. Jennifer Rojas-McWhinney, who is with the Department of Psychiatry over at Texas Tech University. And we are here to talk today about TCHATT, a very important resource. And I'll let Dr. Jennifer here explain to you what exactly TCHATT stands for and what it means. But before we get into all that, Josh, you want to kick us off in our normal interview style?
Yeah, Jennifer, thank you for being with us. Would you start by introducing yourself to our audience and telling us a little bit about your background, how you got to Lubbock, and what brought you right here today?
Okay, great question. Well, my name is Jennifer Rojas-McWhinney. It is a pleasure to be with you all today. I am a Lubbock native, so I grew up in Lubbock, went to a school on the outskirts of Lubbock, a rural school in the middle of a cotton field. And so this is where I call home. I went to Texas Tech University for my bachelor's, master's, and PhD. So I like to say I'm a true Red Raider. I was there for a very long time. Moved away for a little bit and taught at a university in Missouri, and then came back because all of my family is here in Lubbock. And I was teaching for Texas Tech University in the College of Health and Human Sciences for a little bit before I transitioned to Texas Tech University Health Sciences Center in the Department of Psychiatry, where I have been for just over the past 4 years.
Awesome. Yeah. And so can you let everybody know what does TCHATT stand for?
Yes, it is Texas Child Health Access through Telemedicine. It is a mouthful, so we usually do not say all of that, but it is our school-based program that came about during the 86th Texas legislative session back in 2019. During that time is when you had the development of the Texas Child Mental Health Care Consortium. And with that consortium, there were 5 initiatives that the state of Texas pushed out, one being TCHATT, which is the school-based mental health program that's free.
Awesome. And so this is something that I've been talking about for quite some time, trying to get more and more people to know about it, because I don't know if they understand how big of a deal this is, right? Like,
Right.
because you talk about even if somebody did seek out mental health services for their child,
Mhm.
what would that look like cost-wise to somebody?
Right. So I like to start by telling people that there's a shortage of mental health professionals. And we know that that's the case for the majority of the US and the majority of the state of Texas, the overwhelming majority of the state of Texas. So there are different maps that are pushed out that are health professional shortage areas, and they'll just show you which counties are health professional shortage areas. And they do it by different health, dentistry or primary care or whatnot. There is a shortage of mental health professionals across most of Texas. What that means is that there is a higher demand for mental health services and not enough providers at any level to meet that need that exists. So what is typical is that, and I'll speak to our region, and our program covers 85 counties of West Texas. So we're looking at everything from the tip top of Texas and the Panhandle down through Amarillo to Lubbock to Permian Basin. So Midland, Odessa, over to San Angelo, Brownwood, Abilene, and up to Wichita Falls. So it is a significant portion of the state of Texas. When we look at our region alone, the wait for a child and adolescent psychiatrist, so you have adult psychiatry, child and adolescent trained psychiatrist, is ranging anywhere from 8 to 12 months. Most families cannot wait that long for care for their child. And outside of that, when you do get in, if you're going off on your own, let's say not even for psychiatry, but if you're looking for a community therapist, a licensed professional counselor, a licensed marriage and family therapist, a licensed clinical social worker, right? Just to name a few. If you're looking to get in for therapy, it is not uncommon that for an hourly rate, you would be paying $125 per session. And so many families cannot afford to do that. And so what I think is so important and such a benefit of TCHATT is that because it is state funded, it means it is free to families who utilize this service. And we provide services to pre-K through 12th grade students who are in school. And so that takes a huge, load off of families who otherwise would not be able to cover that cost.
Yeah, yeah. Josh, do you have anything to add
Yeah,
before
would you, set the stage for us? Like, what are families experiencing out there in your experience or otherwise? I mean, I myself don't have kids, and so I really have no perspective on what this landscape even looks like.
Yes, no, absolutely. So we look at what are the top reasons for referrals that we typically see into TCHATT. Now, before I answer your question, because I'm going to give you a lot of information about that, I want to talk about referrals because I know that may be a question that people are saying, well, how do I even get into this program if my child is struggling? The way that you get in is you ask your school counselor for a referral and just say, I want a TCHATT referral for my child. Explain why you're asking for that referral. Some children may go to their primary care provider, and their primary care provider may identify this child needs ongoing therapeutic services, or they need psychiatric services, or to see a clinical child psychologist, all of which those providers are within our team. The PCP may write a prescription, if you will, on their prescription pad and give it to the family to say, take this to your school counselor and ask them for a referral into this program. That's another way. So sometimes parents don't identify, it may be their child's physician who identifies that. It may be the school professional themselves who identified this child is struggling. Now across our region, we're very rural. And so sometimes you have school counselors who are working in a co-op, which means, remember I said there's a shortage at all levels. So you have these school counselors who are working in a co-op, meaning they are contracting essentially with 5 school districts. So that counselor can't be at 5 different locations at the same time. So some of our districts do not have a school counselor on their campus at all times. And so that's something too that we'll work with all staff at schools who can identify and refer students into our program. So to answer your question about what are we seeing as far as referrals, what is coming into our program, the number one reason that we see referrals into TCHATT is for students who are struggling with anxiety, excessive worry. That is our number one reason for a referral. Followed pretty closely by our number 2 reason for referral is depression. And so this isn't, oh, I just feel down, right? I feel kind of down in the dumps, but I feel that way for a day. That's not depression. We're talking about a sustained change in mood for weeks at a time, right? Where that is the predominant feeling that this child is having. And so those tend to be our top 2. Anxiety tends to be number 1, followed by depression. We know those tend to co-occur with each other, meaning that they tend to happen simultaneously. So it's common for children not to just say, oh, it's only anxiety and that's all it is, right? Or it's only depression. It can be both that they're experiencing. Our third reason that we have for referrals is attention problems. So the school may identify my child struggling to pay attention in school, or the student is struggling to pay attention. The fourth reason is anger and aggression. And when we see that, sometimes people say, oh, it's your high school students, it's your middle school students, they're acting violently or they're being really aggressive. And that's not where it is. So when we stood TCHATT up, we actually only went through 4th grade. We went to 4th grade through 12th grade students. And we did that because suicide is the 2nd leading cause of death. At the time that we did this, remember we stood it up passed in 2019, stood it up in 2020. At that time, the top leading causes of death for 10-year-olds to 34-year-olds, the 2nd leading cause of death was suicide. And so most people don't realize when we're talking about 10-year-olds, we're talking about fourth graders. Most fourth graders typically enter fourth grade 9 years of age, and they turn 10 while they're in fourth grade. And so that was the age group that we wanted to start intervening and try to capture, right, while they're 9 years of age. Since then, in 2021, it shifted where suicide is the second leading cause of death for 10 to 14-year-olds, the third leading cause of death for 15 to 24-year-olds, and the second leading cause of death for 25 to 34-year-olds. So it's still, I mean, there was a bump for our 15 to 24-year-olds, but it's still at the top, right, when we're talking about leading causes of death. We had schools reaching out to us saying, our little ones are struggling. We don't really have a lot of resources or support. What can we do to help them? Can you see them through TCHATT? So we made the decision, once we knew we had the capacity, clinically speaking, that we would drop down to pre-K students. When we did that, that's when we started to see anger, violence, and aggression jump to our top reasons for referral, because as people with children know, and people who have interacted with children, it's the little ones that struggle with using their words. I mean, sometimes adults struggle with using their words, right? But our little ones are the ones who get more physical in nature, because it's harder to articulate what's going on for them. Another reason for referral, so our fifth reason, is low self-esteem, followed by disruptive behaviors, academic issues or truancy, trauma, suicidal thoughts, and self-harm, or what we refer to as non-suicidal self-injury. So we have high rates of trauma in our region of the state of Texas. And so, and that you can have co-occurrence with trauma and, anxiety, depression, substance use. There's a lot of things that can co-occur with that. So that's typically what we see, again, with anxiety and depression being much higher than anything else that we're seeing.
It's such a dispiriting thing to learn, is so prevalent, but
right.
It speaks to how important this resource is.
Yeah. And one of the biggest reasons why I push this so hard is because I do volunteer in O.L. Slayton Middle School, 6th, 7th, 8th graders, boys and girls groups. I'm around a lot of the schools, Dunbar, Estacado, other campuses from time to time. And I mean, I've seen it, I've experienced it, that, these kids are going through a lot. I can recognize it in them because I was one of those kids that went through a lot and had a lot of childhood traumas and had a lot of, unfortunate consequences because of that in my early life. And so I see it. It's pretty prevalent, and it is sad, but I think that it's addressable, and I'm sure that you could speak to that much more better than I can. But I've noticed a trend because the kids will pick up a lot of the talking points that they hear adults say, right?
Right.
So for instance, if they're trying to be tough and we're talking about our feelings and they're like, oh, I don't feel nothing, right? Which we know that's a response, right? That's a trauma response to you actually feel a whole lot of things.
Right.
You're trying to go the other way, right? And we talk about that quite a bit with the kids and try to get them over that hump, because we do know that they're fighting probably a bunch of the adults around them in their heads saying, don't talk about things, keep everything within these four walls or whatever, don't ever discuss it, don't ever address your feelings, all of those sorts of things. And that can lead to a lot of these things. And so can you talk about the sort of why it's so important for families maybe to change their mind around getting therapy or some help like this?
Yes. And I think that's a great question and a great point that you raise. There still is very much stigma that exists around mental health. I would say that I think it is less than what it was, 10, 20, 30, 50 years ago. But it's still very alive and well in communities, and I think all communities, right? I wouldn't say there's one community that does better without having as much stigma. So it exists, and I think we have to talk about it and give people space to talk about that. I think when we, especially in West Texas, there's a culture of West Texas of, pick yourself up by your bootstraps kind of mentality. Kids they're not in the real world yet. They don't have anything to be worried about. They are in the real world, in the world that they are in, that is their world.
Right.
And so I hear a lot of adults say that sometimes, and it diminishes the experiences and what I guess experiences and feelings of what that child is going through. It doesn't mean that we have to agree with everybody's feelings and experiences, but we can try to understand that. And I think that's where we do a disservice at times is we're just trying to react to that or hush that. And it's kind of like saying, if I were to say, everybody don't think about a purple elephant. You all probably were like, I didn't think about a purple elephant until you just said, don't think about a purple elephant, right? And it's kind of like doing that with your friend. Don't feel anxious. Why do you feel anxious? Stop doing that. Well, you can't just say, don't feel anxious. Oh, amazing. I don't feel anxious anymore. Or don't be depressed. What do you have to be sad about? Suck it up. I think we have to be mindful of our language. And I'm a big believer in modeling, in that I think even as adults, the language that we use is problematic at times. I think we can be overly dramatic with, oh, I'm so depressed. You're depressing me, right? Are you depressed though? Or like, that would kill me. I would die if that happened to me. Would you die if that happened to you? Right? Like, is it really killing you? We just kind of say, like, I'm starving. We just kind of say things without really knowing what that means.
Sure.
And I think when we can model those words and give those feeling words to our kids or to other kids in general, it's very empowering and impactful in a positive way. Just the other day, I was talking with one of my children, and they were really upset, and they were angry. And I said, you can be angry. That's fine. There's nothing wrong with being angry, but there are certain behaviors you can do when you're angry, and there are things you're not going to do when you're angry. And you're not going to throw things and do whatever but sure, there's nothing wrong with being angry, right? Be angry, but let's know how to be angry, right? And so I think when we help kids at all ages, we let them know it's okay to talk about those things. But to your point, I do think that a lot of adults struggle with that as well. And so I think it takes practice to get to that point.
Yeah. No, I think that's so well said. And it was always one of my when I used to be a school teacher, that you brought up one of my principal bugaboos is people would tell kids like, what's it going to be like when you're out in the real world? And it's like,
Right.
they're already in the real world.
They are in the real
completely
world.
real world
Yeah.
that they're in.
And their world is sometimes a lot harder than we think, or that we like to think. And that's a challenging place to be. But you talk about food insecurities. Sometimes we just take for granted, like, oh, there's no challenges. There are a lot of challenges that many kids in our region are facing. And we need to help them when we see them struggling, and we need to know how to identify them when they're struggling. And I think that's a challenge too, because not everybody knows what behaviors to look for, right? I think sometimes they may see things on TV and say, oh, I see all the ads for depression and you're just crying and you're moping and you're sad. Well, that's not typically what you're going to see in teenage boys, right? You may see more aggression in teenage boys, right? In youth. And so, but are we pausing to say, okay, let me try to understand where you're coming from and what's going on, without automatically saying to any child like, oh, you're just an at-risk youth, or oh, you're just trying to get attention, right? You're just saying this stuff because you just want attention. Instead of saying like, okay, why did you say that? Or are you okay? How can I help you? Are you thinking of killing yourself? I heard you say this. Is that really what you're wanting to do, right? And not putting judgment in that question. Not, and the example I give to people is not saying like, you're not thinking of killing yourself, are
Right.
you? Right? Because I've already inferred that's bad if you're going to do that. And number two, I can't handle that if you're going to tell me that. So please don't tell me that. Versus me saying, are you thinking of killing yourself? Right? That's not an easy question to ask somebody. And I may have 100 feelings in myself in the midst of asking that. But in that moment, that question is not about, hey, Jennifer, how do I feel? It's not about me. It's about what is happening for this other person that they are talking in that way, right? What is going on there? And how can I connect them with the appropriate resource? But I have to show that I can be a trusting person. And it may not be that the first time I ask somebody the question or say, hey, I'm here if you ever need to talk. I may have to do that for 6 months, for a year before they say, I can trust her. I'm going to say something to her, right? But I can't take things personally just because somebody doesn't want to talk to me, right? I may not be the one person that they want to open up to, but I can show that I am a safe place if they needed to talk.
Yeah, and this just something that I wanted to add to this whole idea of kids aren't in the real world yet, and we've already sort of discussed, yes, they are, and going back to sort of things that I experienced, which they stick in my mind so strongly, not because I dwell on them, but because I talk about them a lot publicly to try to help people, to try to just tell my story sometimes. But the world that the kids are living in, the adults around them are creating or maintaining, right? And so if that world around them, like mine was, is chaotic and unstable, that causes a lot of anxiety and a lot of insecurity, right? And you grow up all confused, you're trying to develop while at the same time deal with all of this kind of thing. And so yeah, I mean, it is the real world, and you can make it suck for a kid, right? And yeah, do they have to pay bills? No. Do they have to deal with the mortgage or whatever? No. But not only do they have to sort of like take whatever you're dishing out, like they can't even make change. They can't make you do anything, right? Like they can't make mom and dad go to therapy, because we talked about the stigma that's been generations long. So no doubt mom and dad have not been to therapy, right? Maybe, and I put myself in this. I was a very young father, right? A lot of us are young and not equipped to do that. I have admitted that many times. I was not equipped at 19 years old when I had my first daughter to be a father, or to be the father that I would want to be, right? It's just the fact of it. Even when I had my second daughter 4 years later, I was still not equipped to be the type of father that I wanted to be, right? And so I think that a lot of times the adults don't, and I don't know that it's out of like, I don't think it's malicious, right? Like, I don't think they're trying to do it on purpose. I think sometimes adults get so caught up in life and trying to maintain the home and trying to maintain the bills that they can sometimes lose sight of that, right? And kind of lose empathy a little bit with their kids sometimes. And I think that if you could just kind of try to pay attention to that, or even just admit when maybe you don't have it all figured out, right? And
Oh,
maybe
yeah.
help, get some assistance yourself,
Right. And I think a lot of adults are struggling, right? And and we had been asked at times, do you provide services for the parents? And we don't in that capacity where we're going to do one-on-one counseling with parents. We can provide resources all day to parents, but we just don't have the capacity to do that. But there's such a need because of the shortage, and we know that. So through our program, through TCHATT, we will provide resources to parents. We have parent training programs that parents can go through as well with it, if they have young children or teenage kids. We use Group Triple P, and so that's an evidence-based program that we can use or have parents participate in. We go and we give talks to schools. We can customize materials to students. I remember, I guess it was probably 2 years ago, 2 or 3 years ago, one of our districts had reached out, and it was outside of Lubbock, but they said, will you come and talk to all of our middle school students? And I said, yes, I will. What would you like me to talk about? Stress management. Got it. I will talk about stress management. And so I went into the gym, and they had groups of teachers, and I had tons of team members with resource cards and materials, and they just rotated grade levels in and out. And I gave a 30-minute talk, and they rotated them out. 30-minute talk, rotated it out. And then I went over to the high school, and they put all high school grade levels in the auditorium. So there are hundreds of kids, and I just talked to them, right? And we use strategies too, where we will try to give everybody something, a notebook, a pen, something, because we know that kids will doodle. And we know kids can use their phone and take pictures of resources that you put up on a screen, but they don't want other people to see them do that. So if you give everybody the same materials, somebody could be doodling, or somebody could be writing down that phone number. You don't know what they're doing, right? And so we're even mindful of, okay, what are we giving them? What are we putting in their hands, so that the people who are going to write these things down, attention is not being drawn to them for what they're doing, right? And so we will talk to students. We will go to community events and talk with parents or kids who are there. And so we do our best, but like you said, a lot of parents, they themselves are struggling. And so we're just trying to give them the tools to help their child. We know that, research shows us most people in general, it takes about 10 years for them to seek help from the point of the onset of the symptoms that they are experiencing. 10 years to actually decide to go and get help. Sometimes you'll see 11 years. The numbers are typically 10 to 11 years. That is an extremely long time to wait. And so if we think about all these parents and adults who have waited likely all of those years, it is very challenging for families. And so we're doing our part by trying to help kids through TCHATT.
Yeah. Josh, did you have?
No, I mean, that's so well laid out, and I could riff on that for a hot minute, but I'm more interested in what Jennifer has to tell us. I guess one kind of a two-part question here is like, okay, you have a referral. Well, I guess I've got three questions. Let me lay them out. Okay. Every public school in our region is they already have access to this network.
Yes, they all have access.
That one's quick. So it's like if you're in a public school throughout our region, this is a resource that's available to you. Okay.
Correct.
Somebody has a referral now to your network. What does that look like? What do the actual sessions look like, and who is that between? And then the last part of this is like, because this is something that's come up on the show, especially with regard to young people, when we've had other conversations, not exactly like this, but our young people are individuals that the adults in their life are responsible for, but they're not the possession of the adults in their life. They're their own person with agency and a whole future, right? And so I guess I'm curious, what the sessions actually look like, and how you guys maintain like the privacy and the agency of young people. At the same time, like, again, what does that all look like? Lay that out for us.
Okay, so if the referral is given, anybody can identify the child. The parent, like I said, could make a request to their school counselor. It may be that their physician has identified some challenges, and because a lot of our pediatricians and family medicine physicians across our region are screening kids for anxiety, depression, and whatnot whenever they go into their office for well checks. So they may identify just by doing a quick screener, like something's going on, let's go ahead and check out what's going on. And they know that TCHATT is one of the quickest ways for a child to get access to a licensed mental health clinician, a clinical child psychologist, or a child and adolescent psychiatrist. And those are the 3 levels of care that we have within our team. So once that referral is submitted, and I'm going to say school counselors. I know that I said some schools may not have a school counselor. It could be an administrator. It could be fill in the blank. I'm just going to say school counselor for simplicity's sake. The school counselor would submit the referral in TRAIT. Now, TRAIT is the school-based platform that the state of Texas uses for the entire state, for all of the institutions who have rolled out TCHATT. There are 12 institutions across the state, health-related institutions, who stood up TCHATT, and they're implementing it in their region. So the school counselor would submit the referral. Our team will get our referral within our region. So we know what school district it's coming from, what school campus it's coming from. So let's say it's Lubbock ISD and they're coming from Monterey High School, right? We would know what district, what school, what grade level, have some demographic information about the family, find out, why is this referral being made? First of all, what's going on? And then what would happen is we would take that information, and our team, we take that from the school, our team then will reach out to the family. We try to do so within 72 hours of getting the referral, where we will reach back out to the family and we will schedule an intake appointment. And so that appointment runs about an hour to an hour and a half long. And we know that's a long appointment. All of our appointments are done virtually using Zoom. And so much like what we're doing right now, right? So it's virtually. And the reason we do that is because it makes it more accessible, meaning parents don't have to have gas money to drive into Lubbock to go to an appointment. They don't have to have the flexibility of taking off for an extensive period of time, right? If I've got to pick up my child, drive them to the doctor, drive them back to school, that's more time than me just driving for an appointment and going back to work, right? If I needed to, or if I'm taking care of an aging parent at home and I'm driving to the school and driving, whatever the context is. It makes it more accessible. Also, because there is a shortage, previously, some of our clinicians, before TCHATT stood up, we had a pre-existing school-based program where our mental health clinicians would drive out to school campuses and help facilitate the appointments with the psychiatrist. There's no way we could do that today. We work with 232 school districts across 85 counties. There's no way I would have clinicians in a car for 3 hours one way on a highway to go do that. That means that's 6 hours in a day that they're in a car and they're not seeing patients. That's not an efficient use of their time and their skill set and their training. And so those appointments are all virtual. Our team reaches back out to the family to schedule that intake appointment. The appointment will take place on the school campus. Now, some of the charter schools we work with, their agreement with us was a little different because they don't have school counselors at all of the charter schools, or some of our schools are completely virtual, right? Some of our charter schools. So those appointments will happen at the child's home and not on the school campus. But what we have done for the school, for all of our other schools, our public schools, we have equipped all of our school campuses, not just per district, but every school campus with an equipment setup, meaning we provide them a telemedicine cart. On that cart, it has an iPad, a portable scale to measure their weight, a stadiometer, which is what measures their height, a blood pressure machine with multiple cuff sizes, a lighting apparatus, and a Bluetooth speaker. We have all of that equipment there. Number one, school buildings are really tight and they don't have a lot of space. You can see that with some of the portables around a lot of our school campuses. So sometimes these appointments, they're occurring in what we're going to say very tight quarters. And so they need a lighting apparatus to help us be able to see the child's face and what's going on. We need a Bluetooth speaker because we have students and family members who it's difficult to hear from the iPad. We have grandparents who are bringing their grandchildren for appointments. Yeah. And so we have all of the other equipment there because if a child is advanced to our highest level of care, which would be our psychiatrists need to know their height, weight, and blood pressure. Because if there's going to be any, let's say that child's on medication, we're working, their doctor's saying they've tried all these things, it's not working, they need us to step in and help manage get that child situated. We need accurate height, weight, and blood pressure. Well, kids grow really quickly, right? Even if you did a well check, and we know not everybody is doing well checks, but they just grow really quick. And so it's a way to have everything that school needs for those appointments on the school campus. And again, that's just something we provide. The districts do not have to pay for that. Our program has covered the cost of that to make it where they have everything they need to carry out these appointments. I will say our goal of our program for TCHATT is that from the time a counselor has submitted a referral until we have seen them, like we have an appointment with them, we want that to occur within 3 weeks, less than 3 weeks. So we do not want to hit the 3-week mark. Now, on occasion, we will get really close to that, because if we've called and we're playing phone tag with the family, that can push it out. If a family's on vacation, we take referrals year round. If we get a referral at the end of May before school's out and we start calling families, sometimes they're on vacation. So it can be, different things that get in the way of that. But our goal is that from the time we receive a referral to when we see them, not just schedule them, but we see them, we want that to occur within 3 weeks. Did that
Awesome.
answer your question, Josh?
Yeah, no, absolutely. Except I would be curious, just at a high level, if you would tell us like what the actual sessions look like. Is the child in the room alone? I mean, I guess some of this
Yes.
is
Oh, yes, you
dependent.
did ask that.
Are they like in the room alone? Are there sometimes an adult with them? What does
Yes.
that look like?
Yes, no, great question. So it can look different, and because we're working from, pre-K to high school students. With our elementary students, we want parents with them. That can be intimidating for a little child to go into a room by themselves and
Sure.
sit with this device and all this cart and stuff. And we've tried to make it not look too medical, but it still is kind of intimidating to sit in front of. But there are times where our therapist or the psychologist or the psychiatrist will ask the parent to step out of the room so that our clinician can visit with the child by themselves. There are times that we may need the child to step out of the room so that we can ask the parent some questions on their own as well. So think about the same principles, and I'm not going to assume people know what this is, but I will describe. If I were to go in to see a therapist in person, if I say, I'm going to go see my therapist, me walking in, I'm checking in at the front lobby area. And then I'm going to wait in a waiting room, and then somebody's going to come and get me, usually the nurse. They're going to take my measurements or whatnot if they need to. And then I'm going to go and see my therapist, right? And I'm going to sit there in a room, and it's just going to be me and that therapist. In a very similar way, what TCHATT does is we have our front office staff, if you will, and we call them our PSS, which stands for Patient Services Specialist. They help with all of the scheduling. So just like your front desk staff is the same as in an in-person clinic, we have those same team members. They are just doing everything over the phone with our families. We have what we call our clinician assistants, and they are the ones where if it's a psychiatry appointment, they act like a nurse would in a doctor's office. So they're the ones who are making sure, did we collect all the measurements? If they need to get that from the school counselor, did we get all the measurements? Check in if there are any follow-up assessments that the psychiatrist wants to see. Where that child is, work with the family on getting those assessments done. And then they will have the family in a virtual waiting room until the psychiatrist can review that and then log on to the session. So just like right now, if I said, Adam, Josh, I'm going to hop off into the waiting room, I could go back into the waiting room, right? And then I could come back in. So while I'm in the waiting room, you can't hear me, you can't see me, I can't hear you, and I can't see you, right? It's the same concept where we still try to maintain, if we need to talk to somebody one-on-one, we can do that. And that's why we like our families to be with their child, parents, guardians with their child when these appointments are happening, because it allows us the ability to do that. Now, with our high school students, sometimes it's different. And with our rural community, sometimes you have kids going to school in one county and the parent works in a completely different county. And so in those situations, when it's our high school students and sometimes our middle school students, the parent may log on to the Zoom session from wherever they're at. So they're still with us in the session, but they're not physically in the same location. And we also have to be mindful with that, because some of our school districts do not want children by themselves. And so the parent always has to come, or they have to delegate an adult to come to that session with their child, if that's the district's policy. But otherwise, they may log in virtually with their child as well. And we may say, oh, I'm going to visit with so-and-so for a moment, put them in a waiting room. So we can still do the same things. But it is virtual, right? It's different. It's different than being face-to-face with people. But I still stand by, I think this is an extraordinary program we are making mental health care services accessible.
Yeah, and speaking of that, and this might have to be the last question before we let you kind of end us off. So I know you said you're in all of the public schools here,
Yeah.
many across the state. If there are people who maybe work in a school and they'd like to sort of take this idea to their administrators, or maybe there is an administrator watching that is maybe an administrator of a charter school or something, how would a school bring TCHATT into their campus?
Right. So if there's a school district who says, we don't have your services, and we would like to sign up for TCHATT services, they would just have to get in touch with me. And the superintendents, I usually work with the superintendents, whoever has signing authority within that district. Usually that's the superintendent or the deputy superintendent is who that typically is. I would send a MOU, which is our memorandum of understanding. It's basically our contract. Even though it's a free program, we still have to have an agreement of, this is what my team will do, this is what your staff will do, right? This is how this is going to work. And so they sign our agreement, and we process that within our institution. I send a copy back to the superintendent, and we begin services. What our TCHATT team does is we will hold a virtual walkthrough where we will meet with principals, counselors, whomever wants to join that meeting, and we will walk them through the program, the clinical services we provide, but also the educational services that we provide, which is another huge component of TCHATT that we did not even talk about today. But we offer free continuing education units for teachers and counselors and whatnot at the school campus by creating a community learning environment where we talk about mental health challenges and what to recognize in students. And so we're able to do all of those things with this program, whether it's clinical services or educational, to help people be better prepared in responding to the students who have a need.
Awesome. Well, unless you have anything else, Josh, we can let her give her contacts and how can people support all that sort of thing. But go ahead.
Yeah, no, I mean, I would just, say, I'm so glad that this thing exists, because as you say, like you're providing a really vital and high quality service in a region. I had a job where I covered 85 counties. It's probably the same exact 85 counties you're dealing with, or something very close.
Yes.
And yeah, it's a huge region and a huge demand. And so I can just imagine how to tackle that animal that is this big need. You're providing this service in a place where you otherwise probably wouldn't have access at all. You're quite likely to not be able to access at all. And so I just think this is really remarkable. I had no idea that this existed. And so I'm glad you brought it to us. And I just really want to uplift that and encourage people to connect to that and remind them of something that we talk about on the show a lot, which is, it takes a whole community and a variety of different partners to like make our society work and make the whole thing work for the benefit of the people in it. And this is another piece that has been missing, maybe underutilized. And so I'm just really gratified that you guys are out there doing this critical work. That's really tremendous.
Yes, I did want to add one thing that I didn't say,
Please.
because I know
No.
somebody's probably listening to this and they homeschool their children. So we actually will take referrals directly from a parent who is homeschooling their child. And so that parent, now if your child's enrolled in a public school or charter school that we provide services with, which again, all of the public schools in our region are enrolled, all of the big districts, all of the little districts, everybody is enrolled in TCHATT across our region right now. And so that being said, for people who are homeschooling, because we have in Lubbock a high number of people who are homeschooling their children, with that being said, they can refer their child directly to our program. So I do want to give that number for anybody who wants to write that down. So our direct number is 806-743-2291. And that number will connect you with our team of our clinical supervisors, and they will be able to find out, is your district enrolled? If you fall outside of our region here, is your district enrolled? Is your child homeschooled? Is your child homebound? Homebound and homeschooled are two different things. Sure. They can be medically homebound, but they're still affiliated with a district. So that district, you would just need to reach out to your school counselor, ask for the referral. It would be the same process, right? But our homeschooled parents can reach out directly to us. And we have had several parents. And again, we operate year round. So the school academic, typical academic calendar, you have your Thanksgiving break, your Christmas break, spring break, summer break. We do not have those breaks. We are a clinical department. The Department of Psychiatry at Texas Tech University Health Sciences Center is a clinical department, meaning in a typical year, give or take how the holidays fall, we are only closed 7 or 8 days out of the year, meaning we are holding appointments, we are accepting referrals almost year round, minus those 7 or 8 days. And so even if your child is out of school, let's say we're approaching Thanksgiving, as long as we have that referral and you're able to have that appointment with your child from your home, we will continue to have those appointments during that week. Same thing during the holidays in December. We will continue, even when school is out for all of those weeks, we continue to see students during that time.
And I would imagine it'd be tough, but would there be a way, like, let's say somebody's already on summer break and they realize, hey, I think my kid needs these services, and it's like, maybe summer just started, right? And they're out of school, can't contact the counselor. Could the parent contact you directly?
Yes, the parent would be, and we did that. That's a great question, Adam. We ended up having to do that over the summer because most of our school counselors are not on a 12-month contract. They may be on a 10-month contract with the school district. And so there will be months where they are not available. There are months where teachers are not available and it's just your superintendent. But I've also had superintendents and principals reach out and submit referrals when the counselors are not available. So you could even reach out to your superintendent. They know about TCHATT. They're the ones who signed up for it. But if all else fails and you cannot reach them and it's during the summer, or let's say it's during one of these breaks, you can reach directly out to our team. And what we will do is we will make sure the counselor knows that we received that referral during that break.
Awesome.
Yeah.
Well,
yeah,
go ahead, John.
Yeah. Is there, I mean, you've done such an excellent job of laying this out and letting people know how they could be onboarded. Is there anything else that you would like to uplift, or other ways that people might connect with and support your work, or any just kind of closing thoughts that you might leave us with?
Yes, I want to share that when we think about our referral volume and what we have been seeing, I'll go back to 2019, 2020. that academic year, and then looking at where we are to, this past year. In 2019, 2020, there were only 110 referrals that came into our program. Now, we operated under a different name at that time because TCHATT hadn't fully stood up. The following year, we were over 400 referrals. The year after that, we were over 1,100 referrals.
Wow.
2022, 2023, we were over 2,000, just over 2,000 referrals. Last year, we were just under 3,000 referrals. This year, right now, we track our referral volume every month, every academic year to see what is our pattern. So far this academic year, we have surpassed any year prior the number of referrals coming in during the month of August and September. We broke our record over, I would say, at the beginning of last week, maybe the end of the week prior, for the total referrals we received last year in the same month. And so there is a need, and I tell people there is a need, and this need is not going away. And so I want people who are struggling to hear there is a source of support that exists, that is free of charge, that is accessible to you. Ask for it. And if you talk to a counselor or somebody who is new and they're like, I don't know what TCHATT is, keep asking. Call us and say, hey, I've reached out to my school counselor. Did you get a referral? Did you get my child's referral? Ask us that question. And we will be glad to help answer the question for you, because we want to connect families to the services they need, because we know the amount of, I'm going to say, courage it takes for a person to ask for help. And so we acknowledge that, and we want to respond to that. I also ask for some understanding, because what we are doing is so groundbreaking that we're not going to get it right every single time. We're not, right? We are doing our best. I have an amazing team of people that I am thrilled beyond measure to work with. And they are doing their best every day to meet these needs. And this is difficult work to do. So there may be times where it's not perfect, but I can assure you, we are always striving to do the best that we can, and to streamline our processes, and to make sure it is efficient, that it is effective for the families that we are providing services to. So I say that if you're with one of our school districts and you're like, I had a terrible experience, well, let us know that that was a terrible experience, and let us try to fix it, right? Don't stop using us because you had one bad experience, right? If a family had a bad experience, I apologize for that. Give us another chance if that was the case. What we have heard over and over from districts is how excited they are and how thankful they are for these services. I was actually at church, and it was a very random, there was a counselor who's a counselor for Lubbock ISD, and he stopped me and he said, do you work with that TCHATT program? And I said, I do work with that program. And he was like, thank you so much for everything that you do. Our students need this so bad. I can't say enough of how great this is. That is not an uncommon statement that not only myself gets, many of our team members get. When we were delivering carts from April until August, many of the school counselors we worked with, the majority of them, were immensely appreciative for the work that we're doing. And so I say we're doing our best. I think we're on a journey to improve the healthcare across the state of Texas. And I'm very proud of the work that we've been able to do.
Yeah, there's truly nothing so consistent with and coherent with the human condition than it ain't perfect.
Right.
And we're doing our best, or at least a lot of us are doing our best.
We are.
And if we'll keep coming back to the table, we can get there together,
Absolutely.
one way or another. So yeah, no, thank you for joining us. And I hope that, I know you guys are very busy, but I hope we'll have an opportunity for you to come back and talk some more about this, and maybe update us on how we're doing. Adam, anything else?
Yeah, I guess I'll just close this out, but I would just echo what Josh just said. I think that we need to do this, more often, have you back over time, because sometimes people miss a show, and then we do these every week, so sometimes it gets buried. I think this is one of those things that's that important. Even with our technical difficulties today, I felt it was, first and foremost, we didn't want to waste your time again.
Yeah.
But also this is one of those ones that was so important that I felt like we needed to capture this. People need to hear this and see this. This is something that's so needed. I see it every day. Right. I guess the thing I'll end with is you said it, and it's so funny because I literally said this in a speech at an event after that weekend where we lost, 3 people in one weekend, and it was just all sorts of stuff happening. And there was a community event held, and I was speaking to this issue, and in trying to reach people to get them to just ask for the help, I use that exact phrase because to me it is courage to ask for the help. A lot of times in our communities we think it's weakness, right? Oh, I can't handle everything on my own. I must be weak, so I have to go get this other person. No, that's strength because you're building your capacity to help your family, help yourself, help your family. And so I think that if people could just sort of reframe that in their mind and not think of it about weakness, but think of it as actually a strength. You're being resourceful for the people that you care about. And I can guarantee you, when you reach out for that help, as I have many times in my life, as many of us have, you're going to thank yourself later, and you're going to probably think it's a little silly looking back on it and saying, oh, I was afraid to ask for this help. But, now look at how much better off we are down the road just because we simply allowed ourselves to get that help. That, I mean, we can't do everything ourselves. And I guess that's the message I'll end with. We just can't do it all ourselves, right? So thank you so much. And yes, we're definitely going to have you back. And I guess that's it. Thanks. And we'll see everybody next time.
Yeah, be well, Jennifer, and give our best to all your staff who we know are also working very hard.
Yes.
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 Thank you. Thank you.
All right.
Take care.
Good night.